Okay, so now we're going to be asking some questions of our three panelists. And thank you so much. I love the energy in your voices at this time of day in the afternoon. It really helps us to stay awake. I wanted to ask a question of all three of you. A little bit about, I've got so many in my brain before we get some of these other ones, but you mentioned a little bit, Michelle, in your concluding remarks about partnerships. And I wanted to ask each one of you about what partner have we not included in making these initiatives actually work that we should start to include to sort of make our efforts be more successful. And I thought maybe, Margot, we could start with you and you can talk about partnerships that maybe we haven't considered yet.
Well, I actually think in public health we're pretty good at partnerships, and probably in nutrition we err on the side of including everybody when sometimes we should keep some people out of the room at the very beginning. You know that, for example, the biggest coalition that I work in is the National Alliance for Nutrition and Activity. We don't allow the food industry to belong to the coalition, that we need a safe space where public health, children's advocates, health professionals, and others can come together and figure out what is the right thing to do. And then later in the process, we should go to the industry and talk about how to work with them. So I think oftentimes, in nutrition in particular, we err on bringing some partners in too early. Probably not the answer you wanted to hear, but
no, well,
it's my experience that oftentimes this idea of win-win, I think one thing you have to remember is the power dynamic between us, the little guy, the nonprofit, and the food industry is so distorted. They have so much more money, power, lawyers, staff compared to what we have, that you have to make sure that you have other levers, other ways of making change, and to bring us to a point where we can have a discussion as equals. And I probably have some of the best relationships with the food industry, you know, among public health people. We work with food companies really closely, but you have to know when and how, when it should be a partnership, when it should be a lawsuit, when it should be an email writing campaign, using different ways of bringing them to the table. Because if all I did was ask nicely for them to do stuff, we would have never gotten anything done.
Any of my other, Michelle?
Yeah, I also don't think there are huge gaps, but I think with regard to the sort of legal defense, there are some terrific resources that have been developed, toolkits and so forth, by national nonprofits, and that's really wonderful, but I think there's a possibility that in relying on those sorts of things, we might forget to partner with local attorneys who can help cities understand the particularities of their state's law, because again, it can be these arcane points of state law that can make something fall.
You know, I think when we talk about partnerships, there's two kinds of partnerships. Sometimes people take that to mean public-private partnerships, you know, and partnerships with the industry, but there's also broader social partnerships. On the partnerships with the industry, my experience, particularly in New York City government, was when we first tried to bring them voluntarily to the table, we essentially got blown off for several years. And it was really when the city started exercising and making clear its willingness to use its regulatory and legal powers with measures like the trans fat ban and so forth, that industry then came back to the table willing to talk about things because it was clear that if there was no conversation, there would be other types of measures, and legal measures were still needed. But for example, on salt reduction, we were able to work productively with the industry around changes. But I think they only came to the table around salt reduction because it was 2 years after calorie labeling and trans fat bans, and it was clear that there was public will to act on food issues. And then some of these other discussions became more viable. On taxation, so many community entities, legislators, mayors, governors have been bought off by the soda industry. It has been a systematic strategy for years. And I think what's made the more recent taxation initiatives successful is slowly changing the balance of that power and bringing more and more community organizations. The NAACP opposed it for years, but in California they supported it. We were able to get Black churches opposed us in New York when we first tried it, but in California they came on board with the taxes through a lot of grassroots work, community education, outreach, and coalition building. We got the police union, the firefighters unions, the local business districts, and many partners who you wouldn't have expected on board with these initiatives, as Howard County also did from your description. It is possible to mobilize many community partners. It takes a lot of work.
Okay, so one of our questions from our audience is, it seems like these regulations on advertising, labels, et cetera, are now accepted for tobacco products. So what's the difference with sugar-sweetened beverages? Why is it so much harder? How come it can't be simpler given our experience with the tobacco products?
So it's a complicated legal history, but one of the issues was this sort of ascent of the tobacco industry to the ban on electronic advertising of tobacco products, which arose basically because under the fairness doctrine, when the FCC permits one sort of side of an issue to be aired on broadcast media, it has to allow equal time to opposite viewpoints. And so the tobacco industry knew that it was up, once that doctrine became enforced, they knew that they were up against counter messaging in electronic media that was going to be potentially more effective than advertising, and they essentially backed off their opposition and allowed legislation to go through and to remain unchallenged. There's no analog for what's happening now in the realm of food, and so I would not expect the path to be as smooth.
I just say some of it takes time. It goes to that terrific quote, Lynn, that you showed about, things go from ridiculous to possible to normal. And I've found that in almost every big policy that I've worked on, it starts out really controversial. And then over time, as you educate the public and raise awareness and push the issue in various ways, that then it becomes acceptable and necessary, inevitable almost. That, I remember in the early days of working on menu labeling, the restaurant industry, supermarkets, alcohol industry, all opposed really vigorously in New York City and in King County in California. And then over time, as the public got more and more interested in the issue, as we started to pass policies in various places, eventually we got to the point where it became inevitable, And so we were able to pass a national law that the restaurant industry supported. I mean, it was also political strategy of passing state and local policies and then pushing the industry because they preferred to have a uniform approach. But, kids' meals 7 years ago, much more controversial than today. Trans fat, in the early days, I can still remember my first trans fat press conference, and we were just asking for simple disclosure on packaged foods, and the industry coming in and saying we were ridiculous, this was such a stupid idea, here CSPI goes again, the nanny state run amok. And then, we got to the point where we were able to get labeling, and then the science base grew. There were state and local policies to limit trans fat. There was litigation around trans fat. And then, we got to the point where we were able to revoke the GRAS status of trans fat so that, now partially hydrogenated, or we're getting to the point where partially hydrogenated oil won't be allowed to be added to the food supply. And the amount of trans fat in the food supply has declined by over 80%. So if we had more money and we could do, big communications campaigns, maybe we could do these things more quickly because we have to educate the public through Twitter and Facebook and free media coverage, and it's all, kind of slow build up to get to that point. But it takes that time, that, building that base, building the message, educating the public, overcoming the opposition to get to the point where everything pretty much, even getting junk food out of schools, probably younger people don't remember when that was controversial, and they said we should just educate kids. We should have the soda in the vending machine and then just educate them. It's actually an educational opportunity for them to learn to make choices. So, everything I've ever worked on started out very controversial and over time has become acceptable and passed.
Lynn, did you want to offer some?
I just wanted to add something else, too, that comes up, and you mentioned it in the legal discussion, is the evidence base. And trans fat, when we wrote the ban in 2006, we had the evidence base was just the observational epidemiology that was available at the time. there was no experimental data. This was an artificial substance that had been introduced into the food supply. And we said, we don't need randomized controlled trials to take it out again. And it was only 10 years later that, actually in the last 2 years, that really good epidemiologic evaluations were published showing the health impact on mortality, on cardiovascular events, and hospitalizations. That evidence took 10 years to emerge for hard evidence on health. And I think for much of this work that we're doing on sugar-sweetened beverages, it's a similar situation. We have the evidence base of the risk and the epidemiologic relationship. We don't yet have the hard evidence base of how much each one of these interventions will change that. That's going to take longer to build, but I think local communities and states and federal government still need to move forward with innovation and testing and evaluating to figure out how to solve the problem most effectively and to build that evidence base the judges like.
That's good. So here's a question for Michelle. Can you talk about the legal issue in Cook County that has led to the tax being assessed at the point of sale?
No.
Okay. Anybody else know about that? Lynn, do you know a little bit?
They basically, it's legally a tax on the retailer, but it's actually the distributor who pays it. It's a really complicated relationship, and it was modeled after their gasoline tax, and it had something to do with the Home Rule Authority of Cook County and how it had been framed in their laws, because it was very confusing the way the law was written. But in practice, my understanding is that it's the distributors who will pay it and then essentially be paying themselves from what they charge the retailers. That was last time I talked to Cook County.
Interesting. Okay. Here's another question. What can we learn from the Philadelphia soda tax, and what do you think are the next steps?
Well, I mean, the interesting thing about that tax is that, from all accounts, the purpose of enacting it had nothing to do with preventing obesity or obesity-related illness. It was just a revenue generator. That's why it has defined sugar-sweetened beverages to include artificially sweetened beverages that are 0 calorie. So, I mean, I guess what it does is it adds another data point to the accreting evidence base about the effect of beverage taxes more generally, but it's a weird data point since it applies in a way that might affect the substitution of different products. You don't substitute a diet beverage in this case and get out of the tax or a water-based beverage. But it's to even put it in the same category as other beverage taxes is a little bit misleading.
Well, actually, I think Cook County, if I'm not mistaken, is also on both categories, diet and regular. The other 7 ones that were passed were just on sugar-sweetened beverages. It's really interesting for those of us who've been working trying to pass these taxes. Many of us have heard this message from legislators that they would rather talk about how the money's going to be used than about the health effects. And Philadelphia was very successful using that strategy, which was really interesting. Mayor Kenny did a great job with it. And I think jurisdictions that have been working on it more recently have been putting a lot more emphasis on how the money is going to be used. And that does seem to be a successful communication strategy, or mixing the messages about the health effects, and having a dedication. And that's something we've always known from the surveys, that people are a lot more willing to support these taxes if in the survey data you say that the money is going to be going to something that they care about, whether it's healthier schools or pre-K or other activities. So I think these measures will be much more successful if they are framed as generating revenue for something people care about. I particularly would love to see them go to funding prevention. Our public health prevention fund is tanking under the new budget, and it's increasingly urgent for local and state jurisdictions to be able to fund prevention in some way. So that's a very good use of the money, but there are also many other competing priorities, obviously.
I think the one.
I was going to say, just is good use of the money, but also the surveillance to know that these things are making a difference. So when we talk about, how each one of you have had to deal with raising funds and getting grants in order to be able to see an evaluation of the effect of these different types of regulation ordinances, one of the things that, the funding stream can help with is literally continually collecting the evidence to demonstrate the effectiveness of these, in addition to providing services to the particular age groups of children that we're trying to target. Margot, go ahead.
I was just going to say, it shouldn't be surprising that the message that works is the message that best resonates with consumers, right? It's basic marketing 101. You want to meet people where they are. You want to message around what they want. They do not want increased taxes, right? No, nobody wants that. Even, liberals and public health people, we're not that keen on paying more taxes. People want health. They want childcare. They want, you have to think about with each of these policies, as you're lobbying, as you're doing communications, messaging, what are you selling? What are people going to want out of this? And sometimes what we think they should want, oftentimes what we think they should want, is not what they actually want. And so the evidence is for me and CSPI and our coalition partners to decide what policy to work on. But that doesn't necessarily, the evidence is not necessarily the message that I use in lobbying or trying to sell this to the policymakers, to the public. So, for example, school foods was our decision to work on improving the nutritional quality of school foods was very heavily based on equity. Getting rid of competitive foods was to reduce stigma around the school lunch program and to put the foods on par of school lunch and foods outside the meals, improving the nutritional quality of school meals. 70%, more than 70% of kids on the school lunch program are low income. But what worked in lobbying was just to talk about all kids and the importance of healthy school lunch for, to make moms feel good about how they're spending their lunch money. We used equity messaging with a very small number of offices on the Hill, but when we lobbied for healthy, hunger-free kids, we just talked about the importance of healthy school lunch for all kids. Equity was an important driver for us as a coalition, CSPI, but it wasn't my primary talking point on the Hill. And I can think of, with most policies I work on, the reason why I think the policy is important is not necessarily my primary talking point. Another example was working on menu labeling. My first fact sheet was eating out contributes to obesity and all the health effects from eating out. That didn't resonate well in the focus groups that we did. What worked well was, did you know that onion rings have more calories than French fries, that one piece of chocolate cake has a day's worth of calories, that this has more calories than that? And so that became the main talking point. You use the science about how when people eat out, their diets are worse to decide to work on the policy. But you have to decide the messaging based on what's going to resonate with your audience.
Sure. So one of the things that, this whole workshop's supposed to focus on is how do these policies literally target the age group of interest? So can you talk a little bit more, it was alluded to a little bit earlier this morning, but how do each one of these sort of regulations, ordinances that you've worked with, how can we actually see the trickle-down effect to the 0 to 5-year-old kids?
Well, when I was in New York City, the first one we did was daycare because we wanted to start as early as possible in the obesity epidemic, and it was clear that it was starting in infancy. So we kind of started in the youngest age group and then worked our way up to generalizing things. That's really the only, that and breastfeeding are the ones that really directly address those groups. It's been very tough. The rest has been trying to change the general social norm and shift the norm across society, the norm of what their mother is drinking, what their father is drinking, what their brothers and sisters are drinking. You can target more of the children's environments like after-school programs and camps and, work your way around that age group. But, I think it's really going to be the overall challenge of shifting the social norm through the conjunction of multiple policies, education, environmental change. I don't think there's a simple solution.
Well, for kids' meals, it's a little easier because, the kids who are getting kids' meals are the youngest kids. Mm-hmm. And so there's the direct effect on their diet. But as I said before, I think it's more important related to food marketing because restaurant food is the biggest category of food marketed to children, and it's just pushing kids to ask to go to these restaurants, urging kids to want to eat for reasons other than the nutritional quality or even the taste of the food. They just want to go to eat to get the toy, which I think is not a good message to send to kids, you know, from an early age. It's a culturing children to crappy diets, right? To going out to eat and thinking that when they go out, they should eat differently than they eat at home. They should eat food that is not very good for them, some kind of fried chicken-y type of product, and a, you know, pizza or cheeseburger with a side of fries and a soda. It's so, say with the sugar sweetened beverages, if we can make it the norm that kids drink low-fat milk or water when they go out to eat from a young age, hopefully that's a habit that they get used to and carry over, you know, as they get older.
Which is just remember that many countries around the world are banning marketing of unhealthy foods to children. You know, we have not been able to do that in the U.S. for the reasons that Michelle was describing, but that's still what we would need, you know, one of the things that we would need to do.
The only thing I'd say, Lynn, is the First Amendment is not the barrier to passing a law to ban junk food advertising to children. The lawyers talk about that. The politics is what's impossible. I mean, we took the most modest step, the most modest piece of legislation I ever worked on, of passing this requirement for a couple of federal agencies to come together and develop model voluntary guidelines for food marketing to kids. And the industry went berserk and lobbied so aggressively. I still feel bad, Rob, of what we did to the agencies around the interagency work group on food marketing to children. But I mean, they pulled out all the stops and lobbied so aggressively against developing mere voluntary suggestions that they might choose or not. So anybody who thinks, you know, we're passing a law to ban advertising and that the barrier is the First Amendment, that First Amendment is like the least of my problems at this point.
Okay. I'm going to go ahead and end here because I know we ran a little bit over, so that we can go ahead and end the session with Karen giving us some final words, right?
So I think we really need to thank all of our speakers because these were terrific presentations today. And we had great discussions, and for that I want to thank you and the people who were joining us by webcast for giving us your questions so that we could have these lively discussions. So as we prepare to adjourn for today, let's think about all we've learned today, and it's really been a huge number of presentations, starting out this morning with what children, the latest data, as you know, about what children this age are consuming as far as sweetened beverages, some of the guidelines that exist, and then on to the host of federal, national, state, local ordinances, and all these emerging strategies and different kinds of interventions designed to help reduce sweetened beverage intake among young children. So we've really heard a lot of presentations directed at different sources, different locations, and about many different influences on these among children. So tomorrow we're going to continue this conversation, and the first topic tomorrow morning, the first session, is going to be on the role of industry in sugar sweetened beverage consumption of kids. And then we're going to spend time reflecting about what we've talked about and look at the gaps in evidence that exist and therefore the opportunities that exist for future research and work on this issue. We'll begin our presentation bright and early at 8 o'clock tomorrow Eastern Time. So I hope that you are all back here bright and early, and those of you on the webcast also join us at that time. So with that, I'll adjourn this first day, and thank you so much for your participation, and have a great evening, and see you tomorrow.